reaction to the average person has been, if you think that this is going to be the last time something like this happens, you are sorely mistaken. It's almost like the first, it's like the Paul Revere moment has finally happened with corporate oligarchy in the United States. And now they kind of have to look out. They have to look over their shoulder now. Do you think that that's what's happening, and what has been sort of the, I guess what you would say, sort of the rumblings on the ground in New York City at this moment?
Well, it depends on whether the people change anything. If it's just a couple of weeks of grumbling and funny memes, then they have a PR problem, a short-term PR problem, which they'll figure out how to fix. And no one will, at this juncture, announce that they are going to decide how much anesthesia they'll pay for, and you're on the hook for the rest. So nobody's going to announce anything like that for some months. But I noticed something, this immediate visceral response, this consensus across the country, this hatred of these health insurance. It's a scam is what it is. It's a huge scam. The man who died, I've read his compensation was $9 million. Some others say $10 million. And people scrimp on their health care because it covers so little. UnitedHealthcare, BlackRock is a big shareholder. So we know the issue is money. But what I've said is, if we can share these memes, we have to think about doing something revolutionary about not just health insurance, but about this corporate control of our lives. We live under billionaire rule. We live under corporate rule. This is just one facet of this system where in which people depend, in this case, for our lives, on corporations who only are concerned about making money, which means they are by definition not concerned about your life. So I think we need to have a serious discussion. But I also have to say, violence can work.
It's
I hate to say, it reminded me of after George Floyd was killed by police in Minnesota on camera, and they were dilly-dallying about prosecuting the cops, about trying to indict them. They were hoping it would go away. Right. But someone set fire to a police precinct, and then they were arrested. And I said, well, isn't that an interesting coincidence? And I don't want to give people a wrong idea to take actions which could be foolish or dangerous, but it appears that this system does acknowledge the threat of violence. So those are my thoughts about this.
Yeah, I mean, for me personally, this was what I came up with. This is my graphic. So, Peter, do you want to read? Because you usually read the story time, because you usually do it with some sort of flair. Do you want me to just read it? You're muted.
If you could tonight, I would appreciate it.
Okay. So for anybody who's just listening, I put up a chart that lists and has pictures of the top 8 healthcare insurance CEO compensations, one of which was Brian Thompson. So I have him X'd out because, 8, 1 down, 7 here. I don't know. And so what I wrote was, while basic human policy would allow for a week's worth of thoughts and prayers to your family, we regret to inform you that you are a complete and utter greedy piece of shit, whereby you do not qualify as a basic human, claim denied. And so that is the right sentiment. I, for a few minutes, actually today felt a little bad about feeling this way. And then I got over that very quickly. These people are responsible for more pain, suffering, and death than I can, in the short term, in the long term, it's off the wall. And so I do feel like there is a poetic justice in that. And I think our empire has decided to be violent society. We are probably the most violent society to have ever existed on this planet. So to somehow think that desperate, hungry people that don't have healthcare and are watching people suffer aren't going to turn to violence when that's our primary mode of communication in this country. It's just not reasonable. The only thing that surprises me is that it hasn't happened sooner and more. And the one thing I am thankful for is this is what I would at least consider punching up. I often talk about that people are taking out their anger in the complete wrong direction. I have said for a long time, I'm amazed that people are not getting killed, because I know that if my kid died because they couldn't get health care, I don't know what I would do. But there's a reason people are sort of celebrating this, and that shows how many people have been suffering under this system. And so, yeah, I think violent empire begets violent response.
Yeah, it does. And, people don't turn to violence more. I think it's because they are afraid of being punished and caught. I mean, this is one of the ways in which this country is violent, is by having more people in jail than any country on earth. Very draconian sentences. I mean, it's built into the system. If we're going to screw with people this much, we need to make sure they're afraid to do anything about it. And so this is where we are, where people are gleeful about someone who got shot. And the thing I noticed about that graphic, of all the CEOs you displayed, he made the least amount of money.
Exactly.
Mere $10 million. The rest of them were making 20.
But that just shows it's a starting point. It's a jumping off point.
Yeah.
But to me, what this screams of some sort of professional job. This does not scream as someone who was just disgruntled. This was very planned. And handled very professionally. And I know that's like, how would I know that? But this does not seem like just a random person who was upset that their wife died and couldn't get health insurance and just went off like half cocked. So what I'm thinking is, if this is something that's premeditated, then it may or may not really have anything to do with what we all think it should have something to do with, which is just general, complete, loathing at this point for our health industry.
Well, did you see that the shell casings, he'd written the words deny and defend?
Yeah.
So he clearly,
yeah.
I mean, it'll be interesting to find out who this person is, if it was a personal issue or he just decided to get justice for the rest of us. And the video, which of course there's video already of the actual shooting, I thought it was interesting. There's a lady standing nearby. She's just a few feet away from Thompson, and he just shoots Thompson. She runs off and he ignores her, and then he leaves. It was, it's very strange and interesting, but it will be interesting to see who this. I think eventually they will find this person and we'll know who he is. But there needs to be more. We live in fear in this country. We're afraid of getting sick. We're afraid of our housing situation. I'm trying to find a new apartment now with my partner. And I've been in my apartment a long time. And the downside of that is when you look for something else, you can't afford it. I knew, rents were going up.
Right. But
it's much worse than I thought. So where are you going to live? Are you going to get an education? Will you be $1 million in debt if you want to become a physician or some profession that we all need? Where your kids going to go to school? I mean, all of these, the medical debt. I mean, the idea that there is such a thing is so terrible. We live in fear all the time in this country. And it's something that's not expressed that way. Our political system, I mean, they're captured by the people who are doing these things to us. The oligarchs run the political duopoly. So I think what we're seeing, this response, this visceral response, is a reflection of all the suffering that people go through. If people make an allegedly decent salary, are you ever going to be able to buy a house? I mean, it's terrible. Just basic, very basic, modest things that are in jeopardy for so many people. And this man, Brian Thompson, who was shot, he's a stand-in for all of it, for the banks, for the politicians, for the other corporations. And he represents all of these people who make our lives so hard. So it's actually not surprising that there's been this reaction.
Yeah. That's how I feel too. And I honestly think, and I hate to say it, like, I don't want to feel violent. I don't want to feel that way, but there's so much rage and anger, and I have health insurance, and yet our deductible is ridiculous. So, and so of people that I don't know anyone personally that has not had some problem in some way or another with managed care. I don't, one way or another, like on a spectrum, but I mean, Amy Valela's daughter was killed because of lack of coverage and what was going on with her insurance, agency. So like, this is crazy.
It is. Anthem, the company that said we're only going to pay X amount for anesthesia. If you're under longer than that, you're on the hook for it. I have Anthem. I turned 65 a few months ago. I do have Medicare. Medicare is primary though, but secondary is Anthem. Anyway, that's the way it works out. And so I was like, Anthem, the thing I have, I guess I better never need surgery. And there was some pushback from politicians. I guess it was one of those things that was so grotesque that they couldn't, the governor of New York, I don't know if she really did. She made this announcement. We pressured Anthem and they backed down. And I don't know if she actually did anything, but they've gotten away with so much. Why shouldn't they think they could get away with one more thing to victimize us? And the rights Human Rights Day is coming up. This should be a human right, having health insurance, but it isn't considered that at all.
Right. I actually think healthcare and housing are both human rights. So there's that. But I'm a crazy socialist in that way. So what do I know? Peter, you were going to say something before.
So I've had this sheet for quite some time. It was in response to HR, it was House Resolution 676 and Senate Bills S1804. This is for Medicare for all.
Okay.
The USA spends twice as much per capita on healthcare as any other industrialized nation, yet we rank near the bottom in nearly all health indicators, including life expectancy and infant and maternal mortality. 30 million Americans still have no health insurance and climbing, and another 40 million are underinsured. And then you have the probably 100 million that have insurance, but could be one nasty accident away from being in complete and abject poverty. Most U.S. household bankruptcies are due to medical bills, and most of those households have health insurance. Our prescription drug prices are the highest in the world. Congress has prohibited Medicare from negotiating drug prices. Each year, $1 trillion of our healthcare dollars go to administrative costs, aka profit for doing nothing. Having just a single payer like Medicare can cut administrative costs in half, saving us over $500 billion in medical expenses a year. Negotiating drug and medical device prices can save us $150 billion a year. The savings are more than enough to cover all Americans' health care, including dental, vision, and prescriptions, with no copays or deductibles. Funding for improved Medicare for all will be less than current healthcare expenses for 95% of households. Care remains private with free choice of doctors and hospitals, meaning that you're just removing the for-profit middlemen in between us and our doctors. Health decisions will be made by you and your doctor, not an insurance company like United, which denied over 32% of all medical requests.
That's in-network, by the way. That was in-network requests.
Instead of focusing on maximizing profits. Medicare for all will strengthen business, as employers will no longer be required to provide health insurance. You ask any doctor, physician, like Jen's husband, will tell you, yeah, I don't want to deal with the administrative bullshit anymore.
No.
Did. Companies will be better able to compete globally. And finally, Americans can change jobs or become entrepreneurs without fear of losing health insurance.
Yeah, it's funny. I'm remembering my primary care physician who I went to for like something like 30 years, who retired a couple years ago. And I remember him telling me, never get UnitedHealthcare. They don't pay for anything. They're terrible. So I'm like, okay, that's stuck in my mind yesterday. But there's something else you pointed out, that we depend on employment, being employed in order to have health coverage. So you'd think that corporations would say, we don't want to deal with this anymore. Take it off our hands. Let's have single payer. But they don't. It's part of the same, I'm going to call it a conspiracy to keep us beaten up, to have austerity, to have a race to the bottom, to have a workforce that's compliant. And if you have people who don't depend on a job in order to have the bad health care they get, well, then you're going to have people who won't stay on a job, or who will be ready to go on strike, or who will make some sort of demand. So these corporations, these entities, you would think would want to have a different system. Instead, it works to their benefit. I mean, it's really insidious when you think about it. But you mentioned also the Medicare, that I believe it was during the Bush administration. I think it was Bush, where Congress said the government was forbidden from negotiating drug prices. Well, then Democrats subsequently came in and had control of Congress. They didn't change that. They didn't undo that. No. So it just shows you the degree of collusion in the duopoly, the collusion between Democrats and Republicans, that, people being bankrupted, not having doctors at all, dying too soon. And there was something else I've heard about recently, and it's healthy life expectancy. It's not just how long you live, but how long you live as a healthy person who can do the things you want to do. The U.S. ranks very badly. I think we're like number 10 or 11, something like that. Yeah. And all these other countries that we think are less advanced, to your earlier point, all do a better job of keeping people alive and healthier for a longer period of time than in this country.
One other thing that I want to point out that I think is important for everybody to understand, we think about who spends the most money lobbying Capitol Hill. Mm-hmm. It is private insurance and big pharma, because their commodity is something we don't actually need. We can have a long drawn out conversation about big oil, but the fact of the matter is people are very dependent on energy, and we are not in a position, even though Jen and I disagree, I'm a huge advocate for nuclear power. My goal is to get us off of fossil fuels as quickly as possible.
And my goal is to live in a hobbit house in the woods and not have any of that disgustingness.
Exactly.
So, we have different goals.
We do not need for-profit middlemen in between us and our doctors. There is no excuse for it. There is no rationale for it. This has been a scam of scams forever. When I think back on Reagan's legacy, the one thing that never gets talked about enough is way back when they saw a future for him in politics in the 1950s, he was the pitchman for General Electric. This was a man who literally told you that if you had healthcare, it was going to lead to communism. He was paid very handsomely to go on TV and say these terrible things about, which was all not true. And that in many ways became his legacy. That still doesn't get talked about to this day. And so here we are today, and we look at all of these major corporations in the health business. Mm-hmm. United is number one. This last fiscal year alone, they profited $80 billion on a backdrop of $189 billion spent by their customers. You know how much it costs them to lobby Capitol Hill to make sure that no single payer bill makes it to the floor? $5.5 million. Now, normally that would seem like a lot of money. And of course, we have probably a dozen major insurance/pharma companies that probably spend the same, if not more. But in United's case, because they spend that 5.5 million and are able to achieve an $80 billion profit for their cause. That's a 14,500% profit margin. I would say that they're spending their money pretty wisely, Margaret. How about you?
Yeah, well, they're not spending it on us. They spend it to keep this grift going, and that's all it is a grift. They even have big pharma has some sort of system that also increases our pharmaceutical costs between pharmacies, and I don't understand it exactly, but it's one of the reasons pharmacies are struggling. There's always some middleman to help somebody make money unnecessarily. That's it. Congress is just a big money laundering operation for big pharma or health insurance or the military industrial complex to do all kinds of things we either don't need or that are harmful to us. I think that backdrop explains the presidential election, where people, and everybody doesn't articulate it all the time, but people know they're being screwed. And for someone to, Democrats usually to make the case that they're there for the people, but they don't mention this at all. And then everyone's like, oh my God, 6 million people voted for Biden and wouldn't vote for Harris. Well, yeah. What are you surprised about? People aren't stupid. They know that these entities are getting all kinds of help, big pharma or insurance or military industrial or big banks or, on and on and on. And that's why people hear about this man being shot and there's this glee and, a kind of feeling of liberation that one of them got what was coming to him. So, but I still say this is an opportunity for us, and reflecting on the reaction of people about what it is those of us who want to see change, what we need to be working towards. An angry group of people can't be motivated. And how do you do that? That's a bigger question. But I think it's clear to us that millions of people are ready. They're ready for something new and revolutionary.